thank you so much, everyone, for being here today with me. I know that you had 2 amazing days with a lot of information, but please bear like the next hour with me to understand how we could in the future implement these technologies in veterinary medicine. And of course, the initial information that we need to pass through, we know that changes in veterinary medicine, they're happening right now, right today, at home, in the veterinary clinic, in the hospitals. It's not a sci-fi scenario that is going to come in the future. And all of this revolution, all of these devices and all of these technologies that they are entering the veterinary space, they are powered by one important component, which is data. And the point is, in order to improve these tools, how can we collect more accurate data that we can use in order to train our algorithms? And this brings us to our first point today, which is the wearable devices. Like already there were some questions before about these tools. And wearable technology, it refers to electronic devices that they are worn usually either directly on the body or they are accessories or they are integrated into clothing. The wearable devices started as a different kind of tracking and fitness accessories in order to track how much activity did we do this week, how many steps did we take, sometimes our heart rate during our activity, but now it's proven that they can be used, especially in the future, in the medical field, in the veterinary medical field, and they can help us to monitor patients, especially in the continuity of care field, and they can help us even to support therapeutically patients. This brings us to the second point of the introduction. So it's not only the wearable devices that are going to give us data, it's also another concept, the Internet of Things, which is more devices at home that we can use. And Internet of Things, to give an explanation, it is a paradigm where we have connected devices that they can collect data, they can communicate, and they can act on the collected data. You might know the Internet of Things from smart homes. They started from infrastructure, they started from architecture. So in smart homes, you can just wake up in the morning, you can say good morning to Alexa, and your music is going to start playing without you actively need to turn the radio on, to the speaker on. You will also, the lights will also turn on without the need to actually go to the switch, and maybe your coffee is going to start brewing in your coffee machine in the kitchen. And how does this translate to veterinary medicine, right? We don't need coffee for our dogs. So by building smart care ecosystems, which potentially in the future we will be able to do much more effectively than we can do today. So let's go back to the future. Let's go in 2030, like 5 years from now, and let's investigate Knox. Knox is a senior cat, so more vulnerable than most animals that we might have as pets. And the owner, Amara, knows about potentially health hazards and decides to implement an Internet of Veterinary Things at home in order to make sure that Knox receives the healthcare and attention that needs. To achieve that, Knox has a wearable smart collar which can collect information about the daily tracking activity, the daily running, the daily sleeping of Knox. She has also a smart feeder which can collect information about how many times Knox is eating, how many times is going to the smart feeder, how much food is Knox eating per day, per week, per year. You understand that this is continuous streams of information that are being fed to the applications. Then we have a smart water fountain, similar with a feeder. We know how many times Knox is going to drink, how much water, and this might change daily, weekly. Then there is a smart litter box. We talked a lot about smart litter boxes yesterday, so you have already an idea, because these products, some of them already exist. And we can know the weight, and we can monitor the weight of NOx throughout time. We also know how many times the cat went to the litter box, how many times used the litter box, and even we can weight the amount of urine and feces that were produced. Potentially a pet watch cam that when Amara is at work and there is a notification or there is a problem, she can connect at home and she can see how the cat is doing if there is a potential emergency. And a smart pet flap in case that the animal is an outdoor cat. And let's say now that, of course, Nox is a happy and healthy senior cat, and at some point Amara receives a notification in the application that says the past 2 weeks Nox is not running as much. It doesn't have the same amount of activity. Very little change, not something that Amara, a busy person that like most of us and like most of pet caregivers, would notice. Small changes in the behavior. Also, the water fountain ring the bell that Nox is drinking a bit more water than usual, and potentially the litter box also rang the bell that the cat is using it a bit more than used to in the past. All of these changes without any concrete clinical symptoms. So Amara decided to call her vet, book an appointment, just to make sure that everything is in order. In between the notifications and the appointment, of course, Amara was able to extract a full report from the applications, from the IoT connected system, with all the tracking parameters throughout time, and be able to send this to her vet. So the vet already had an overview of the cat's history, an overview which covers the period since the previous consultation, which most times we don't have. We have to rely on histories and previous consultations, and in between, we have the memory of the pet owner and all the information that they can remember or that they could visualize at home. So going to the consultation, the veterinarian already had the information needed and would be able, of course, to ask for the necessary tests and to evaluate the condition of a cat at an earlier stage and start any necessary management before the symptoms arrive, which means that this can extend the happy life for a pet and the longevity potentially. And we go to a second scenario. We stay where we are in 2030, and we go to a dog case. So let's say that Milo is a happy 3-year-old dog, which potentially has a history of repetitive skin issues, potentially connected to an atopic dermatitis. And at some point, the owner could receive some alerts through the application that inform them there was some unsettling behavior and some leaking the past days. For a dog that has long hair, you might not notice an area of redness or an area of a small lesion on the leg. However, the application could pick it up. The tracker that the animal is wearing could pick this kind of small changes up. And then the owner, Elena in that case, could connect, could ask through an AI-powered application that is also connected to her vet, could explain the symptoms, could take a picture of the lesion, upload the picture, an AI system can go through, an AI system that already knows Milo's case, already knows the history and previous problems of the dog, and could give a first examination of what could be the problem with Milo, connecting, of course, to the vet for a remote consultation, which in many cases, and especially with animals that are remote and they cannot have access to care, it's really bridging the way that we care for them, to have the option to connect to veterinary care from home. So during the time that Elena is waiting to connect to her vet remotely, it's possible that all of the wearable devices at home, whatever she's using in order to track the health of her dog, they're going to upload all of this information, curate, because they could be powered by an AI system, so curate a very well-written report that the veterinarian can go fast through, can see the pictures and the report from the AI system that scanned the pictures, and can be prepared for a fast consultation that will follow. Can also have recommendations when to book a follow-up and make sure that the animal is being monitored till we are 100% sure that the condition is evolving and everything is fine. And this is technologies that can be integrated in the future much more seamlessly in how veterinary care is flowing. But in order to be able to implement technology in our clinics and in the way we care for animals, there are some important elements we need to keep in mind. And the first one is we are not innovating just for the sake of the cool technology. That's not the point. The point is not to say that my clinic has this amazing AI tool. The goal is to identify which clinical problems and which clinical challenges do we want to solve with this technology. This is the initial part. As soon as we identify our goals, then we can investigate which technology can help us to solve this problem or this challenge. The second part is that we need to ensure that we have the correct infrastructure. Any new technology that we want to have in our clinic, it shouldn't be an add-on that doesn't match with what already we are using. We should make sure that there is software that connects the new technologies with the already established pipeline. Otherwise, it's not going to work. It's not going to be adopted. We want to make sure that the work flows better, not that it becomes an extra burden to use new tools that we were not using before. And the third part is that it's easy to use. If we want to suggest to a pet owner to use some devices to track the health of the animal at home, if we want to suggest to our clinicians, to our colleagues, to use some tools at work, we need to make sure that they're intuitive. We need to make sure that they are easy to use and that the platform, when they are going to use it, it's not going to be complicated. That is the most important thing to ensure adoption. Also, we need to make sure that we provide technical support and help for all the colleagues and the pet owners that they decide to use these tools at their home or in the clinic. And this needs to start from the clinic and from the veterinarians. Again, to underline, the true veterinary innovation, it is not flashy. It is invisible. It is what can be powered with the current infrastructure, what runs in the background, and what supports our work. This is how it should be in the future. This brings us to the second part of the talk, which of course you have heard already a lot about, and which is artificial intelligence. And of course we cannot cover all kinds of models and all kinds of applications that artificial intelligence can be used for in veterinary medicine. We are going to focus on the large language models. Already in the previous talk, you have seen some ideas of how it's being used and what it can do. Now, what are the large language models? So they are software, they are machine learning models that they have been trained in vast amounts of text data, and they are able, when we prompt them, so when we provide a question to them, they are able to give us a response which is similar to the human communication. Initially, they became very popular with the release of ChatGPT in 2022. And since then, we have seen a lot of other models that they were launched. And the most important of them is the multimodal LLMs. So the initial one was the ChatGPT 4o, Omni. The difference between the MLLMs and the LLMs is that the multimodal ones can accept as inputs different modalities. So apart from text, they can interpret data, they can interpret documents, they can interpret voice, they can interpret sound, they can interpret video. And this is very important for clinicians, for our work in the clinics, because we are multimodal. by nature, our work is multimodal. When we receive a patient, we will ask for history, curate our notes, create some text data out of it, which we will interpret later. We will then examine the animal, which means we will hear the thorax, so we will hear the heart, we will hear the lungs. We will also observe how the animal is walking, how the animal is running, especially if there is some lameness. And then we are going to request tests. So we are going to ask for imaging in many cases. We are going to ask for ultrasound. In other cases, we might ask for blood results. And maybe if we have a lump, we might also ask for pathology or for cytological examinations. We will take all of these different types of data, we will think about them, and then we will create our potential differential diagnosis, our diagnosis, and suggest our treatment. And that's how artificial intelligence systems can help us to think. They can also get all of these data points as input, and they can provide us with ideas on how to proceed on a case. ChatGPT 4.0, of course, it was the beginning of the multimodal LLMs, and we will see how these models are going to improve and are going to change in the future. And of course, they will have much more potential and applications than they have now. Another point to for sure underline is the workload, as the previous talk discussed about how much the decision making is going to help us decrease the amount of time we are spending, and how much it's going to help us see through the data. If we start collecting data from wearables, if we start implementing IoT, this is going to explode the amount of data that a clinician receives in order to be able to diagnose a case. An AI support tool is going to see the data and is going to help us read through it better in the future. The second part is the digital assistant. You can find it with a lot of different names. And these tools are usually in the initial consultation. They can listen through the consultation, listen through the discussion between a doctor and the patient, or a veterinarian and the pet owner. And without the need of the vet to write down the notes, they are able to transcribe the notes. But because they're also powered by AI, they're able to remove any kind of noise in the dialogue and curate very well-structured notes, helping us to standardize the histories, standardize the way that we are saving the notes in our systems, and potentially reducing the workload that we need to put. So we can spend in the consultation room much more time communicating with the pet owner and much less time trying to write down what the owner is saying. Of course, at the end of the consult, we need to go through the notes and make sure that they are accurate before we are going to input them in the history of our patients. My next point is the contact monitoring systems. So nowadays, when we are hospitalizing a patient, usually we have standard times that we have to go, remove the animal from the cage, be able to do a clinical examination, write down the notes, and then return the animal in the cage. However, for an animal that is already in an unfamiliar environment with people that doesn't know, many times when we try to examine outside the cage, we will see that the temperature will go high, the respiratory rate will go high, and we have to guess if this is a real thing or if it is because of stress. Being able to have tools that will collect this data continuously when the animals are hospitalized without the need of us actively intervening, it's going to be able to create much more accurate data during hospitalization and decrease the workload also for the workers, that they have to, a lot of times, even battle with animals in order to do that. The last part is to try to provide personalized care, and to try to be able to bridge the time between the animal is released from hospitalization and returns home, and during the recovery period or during the management of chronic conditions. And health coaches or health assistants at home, virtual tools, is what we can use for this kind of cases. So we can have an AI-powered application which is trained on the history of the animal, knows exactly what are the problems of the pet, knows what kind of treatment the pet is going to receive at home, and will be able to answer questions and guide the owner of the pet on how to provide the treatment, when to provide the treatment, making sure that the full period of time that the animal is recovering and is under care is not going to be based solely on what the owner remembers from the consultation, which of course, in many cases, it might not be a foolproof treatment plan at home. And in order to achieve all of these amazing goals in the future, in order to be able to integrate these technologies, we need to make sure that we know more about AI, what it can do, how it can be integrated, what are the digital tools, what they can do, and how can we use them. And we are at a great moment, because right now, all of these tools are starting to be part of health. We can be part of their creation. We can inspire, identify what we need out of them, and inspire the people that are creating them to work on the ways that we want and we need. We need to make sure that we are training our teams, that we are spreading the word about AI. And this was a paper by the American Veterinary Medical Association, which underscored that the adoption of AI and the use of these tools was very much related to the previous knowledge or previous use by the veterinarians. So education is what is necessary in order to be able to use them in a larger scale. Like every treatment, like every medication that we are prescribing in the clinic, AI and digital technologies come with their side effects, and we need to treat them as that. There is no technology that doesn't have challenges, and we need to be prepared for this. The first part is validation studies. So all of these tools that they are out there and they are promising what they can track, what they can do, how they can answer our questions, their potential and their actual capabilities need to be validated. And they need to be validated by research and by studies. The second part is how we are going to use them. AI is a tool to help us, to brainstorm with us, but not to replace us and not to make our decisions based on what it says. It's there to think with us. It's not there to care for our patients itself. The last part is data privacy and data security, and this is a big topic that has been discussed many times. There are a lot of ideas, a lot of opinion papers, and a lot of ways that people are proposing how can we protect the data collection and how can we protect the sensitive information of our patients and, of course, of the pet owners. One way that, one new idea that comes to people's minds, most medical professionals are suggesting, is to, instead of using the large language models, to move to use medium or small language models. The difference is that the large language models, in order to be run, we need to move the data in the cloud. We cannot run them locally. However, if we have smaller models that they have similar performance because they are more specialized on specific tasks, in our case on veterinary medicine and veterinary medical data, they will be able to have comparative performance, but the information can stay in our computer, or can stay in the wearable devices, or can stay in the equipment that we are using. And of course, it's much more secure than the information that goes and is stored in the cloud. And the next, apart from the tools, it's also to make sure when we are implementing an AI tool or a digital technology is to discuss and make sure we know the full process of how the information is being stored, how the information is being handled, and what the company plans or is doing with this information. We need to know the full process before actually implementing any tool in our clinic. Let's not forget that the pet population in the world is rising. This is only in the United States, the chart, which is clear the trend that starting from 95 till 2025, you can see the number is going up, the general trend. And other markets, apart from the United States, also show a huge amount of pets that they need our care. In conjunction with the fact that animals live all longer due to the very good quality work that we are doing, we need to understand that we need technologies that will enable us to better care for pets, to better care for animals, and at the same time to be able to deal with all the workload that we have. We, and of course all of our community and our colleagues. My last point, let's not forget that behind all of these tools, there are veterinarians, technicians, nurses, that they are working very hard in order to curate the data, to create large data sets that all of these tools are powered by. And this is, believe me, a lot of work. It's years of work and very hard work. So we need to give some recognition to the human work behind every smart algorithm. And with that, I would like to thank, of course, my team and the Purina Institute for organizing this amazing event. Sorry, yes. You can see Mr. Grumbledore again. I know he's very, photogenic. Yes, and of course the Purina Institute team that they did an amazing work to make this event happen. And yes, thank you very much. I would be very happy to take your questions.
Thank you so much, Dr. Kousi. Do we have any questions from the room? We have some on the Slido. So you did talk a lot about how we accelerate adoption and some of the concerns with data privacy, which people are very concerned about. But one thing that hasn't been addressed so far is the environmental burden of AI data centers, and how can we mitigate those in the future to reduce their carbon footprint?
Well, one way, of course, when we are running a medium, because I imagine that this is more to the large language models question, that is usually what causes a big economical and environmental footprint. So one way, if we move from using a large language model to using a small language model, which is more technical, it is more specialized to veterinary medicine, and it can run locally, already it reduces the impact, it reduces the amount of energy that it needs, because again, it can run in our computer. That is one way to decrease the input. The other way is to have standardized guidelines of how to ask questions. This is like by decreasing the amount of words that we are using, already it makes an impact because the AI has much more rich data from our question, but more compact. So it doesn't need a lot of time to go through the question itself. And this also can decrease a bit the amount of environmental impact that the large language models have in the environment. But it's a very valid question, and unfortunately it's true that data centers need a lot of power to be able to deal with the huge amount of information huge amount of inputs that they receive per day.
Yes, that's a good point. The concise questions are very attainable for everybody to achieve too, so that's great. Is there a question back there?
Not a question, but more of a statement of gratitude. Dr. Kousi, that was an amazing lecture. And as somebody who has been told over and over again that my job is going to become obsolete because of AI, one of the points that you made about using these tools responsibly, and it is that in and of itself a tool, and that we still have to use the beautiful brains that we were given, was so encouraging. And so just for the room, I want to encourage everybody to follow Dr. Kousi's example and use this as an opportunity for communication and education, so that when we are talking about the amazing opportunities we have for AI and to make our jobs more efficient so that we can help more patients out there, that we are using the opportunity to educate those that would use it, that this is not a replacement for veterinarians, for clinicians, but again, to be used as a responsible tool. So thank you so much for making that point. Truly appreciated.
I'm very happy for this.
Thank you so much. That's a good point. I think if we could pivot back to the acceleration of adoption point that you touched on, and I think Dr. Boland's point speaks to that too. Are there certain partnerships that might be helpful between industry and academics or the veterinary users that might be using it that might help with acceleration of adoption of some of these technologies?
Well, as I think I touched also a bit during the talk, the goal, we are in the beginning. All of these tools are at the infancy. So if we are really, as a community, ready to embrace them, we know what they can do. We can influence what industry will create. We can basically ask what we need for, instead of wait to see what is being created and then to get to adopt it. So the goal is to identify what are the main clinical challenges and then see how we can solve them. And there could be a collaboration between the clinicians, that they have the challenge, they have the problems, and they can clearly explain what is the challenge, and the creators, the tech people, that they don't know how the consultation room works, but they could have and could create the solutions. Of course, a dialogue needs to be based on knowledge and on experience and on feedback on both sides.
Thank you. There's a question in the room.
The question is, I'm from China. Lots of we do not have a good DVM education systems in China, but we really have similar populations of the pet. Lots of people want to do these AI systems. Most difficult for us is the sound of the voice. How do you have standard? What meaning of the dog and cat, their sound, their voice, the meaning? You should have standard, and then you go to the AI systems. Do you have the standard for that?
I'm sorry, I need to ask for to clarify me a bit the question. So about what is the technology we are talking about?
You know we have X-rays, we have standard, but we do not know the dog or cat, their sound, their voice, the meaning of that. Do you have standard of that?
If there is a system that can identify the voice and different kinds of expressions from the animal, right?
Yes.
So from what I know is that a lot of people are working not so much on the sound side, but to try to use AI to identify from the expression or from the body position of an animal, the levels of pain. And this happens in different animal species. So not only in dogs and cats, but also in other animal species. Because already we have there are the general guidelines that explain how to evaluate and how to see pain in an animal, what kind of movement and what kind of facial characteristics to base your diagnosis on. People are working on it because whatever you can see with your eyes, it's easy for a machine to pick as well from a video.
But big challenge is maybe 20 years. If I were a doctor, we work for the 20 years or 30 years. Maybe in the clinics, we know the meaning of that, the pose and sound animal shows. But a lot of data is from the pet owner. Pet owner really don't know what is the meaning of that. We need a lot of the data, how to collect this data and to make for the systems and clinical use. And
You are raising a great point. So to make a data set which is accurate, which is well collected, which is annotated precisely so that an AI system can go through and be trained, it's a very difficult task. Of course, in medicine, because we have the information are sensitive and we need to make sure that they're not going to trace back to the patient. Especially if we use wearable devices, we are not going to release information that are sensitive of the animal if we are using GPS, for example. And it's a very difficult task. I cannot answer it to you precisely what is going to happen and how we will collect better data. So it's not a prediction matter. I can tell you that right now there is very little data set that is released out there that we can use. So for sure, invest as a profession, as a community, invest more money to understand how to make better data sets and to actually put the time, put the money to make these data sets should be one of our priorities, yes. This is the only way to make better system. It's the data. Everything starts with the data and finishes there.
Thank you a lot. Thank you.
Thank you for your question. All right, thank you so much, Dr. Kousi. It was a wonderful talk.
Thank you.